Good morning and welcome. You're watching Thriving on the Suncoast, and I'm your host, Michael Jones, owner of Comfort Keepers Home Care. First, I'd like to acknowledge some of our sponsors because without them, this show wouldn't be possible, bringing this great information week to week. Health South, one of the premier rehabilitation hospitals in the area, my choice for if you want to get back on your feet quickly. They've got an amazing program for getting people back on their feet and rehabbing you quickly. For inpatient. For outpatient, you want to look at physical spelled with an F. Physical therapy, they've got doing a free balance testing program. One of the big reasons people are getting injured and going to the emergency room. Get your balance checked out. These people have the knowledge and the techniques and the tools to help you stay healthy and stay off the ground. Dr. Fred Harvey, functional medicine doctor, one of our regulars here, believes that optimal health doesn't come in a pill and really helps you get at the root cause of your disease process, so give them a call. And Bill Mercer, Reverse Mortgage Associates, can help you get tax-free money out of your home so you can use it for whatever purpose that you want. So now we're going to talk about our show. For many years, people have made jokes or kidded about how their mates are snoring, kept them up at night, and made it hard to sleep. And it almost seems like everyone snores, but snoring in itself can be benign. But it might be a symptom of a much more deadly problem, a problem that can lead to a myriad of health issues like acid reflux, memory disorders, high blood pressure, heart disease, depression, and many, many more. And what's worse, it seems like almost everyone's getting diagnosed with this problem. I am talking about sleep apnea. Here today with us to discuss this serious problem and some unique treatment options is Dr. James Cannon, a dentist who has opened the Sleep Apnea Institute of Sarasota. Dr. Cannon grew up in Gainesville, Florida, and did his undergraduate in dental school at the University of Florida, with a postgraduate training at the University of North Carolina, Chapel Hill. He's lived in Sarasota for 12 years, married with 3 daughters. Welcome to the show, Doctor. So sleep apnea is a huge issue. It's dramatically undiagnosed in this country. Tell us a little bit about what that is.
Thank you for having me on the show, Michael. I appreciate the opportunity to speak to your viewers about this really serious medical condition. Sleep apnea is characterized by a cessation of breathing during sleep. It really, at its root, is caused by, during sleep, the muscles of the throat begin to relax. The tongue kind of falls back into the airway and closes it off. To kind of contrast this to snoring, because everyone knows about snoring. Everyone knows they've been kept up all night by somebody snoring in the room, or maybe they've been the one keeping someone up.
You don't even know you're snoring.
Exactly.
Unless somebody tells you.
Exactly. Or you're just still in denial of it. Yeah. That is the analogy is like a garden hose. Now, normal breathing air moves in and out. Like water moves in and out of a garden hose pretty easily. When you kink the garden hose, you get that gurgling there where the kink occurs, and that's what's happening with snoring. The airway is beginning to close down, the tissues are vibrating, and creating that sound. Sleep apnea is where you would take the hose and kink it completely and no water's coming out, and that's really what's happening with apnea. The airway closes completely, air is not getting into the lungs, therefore not getting into the bloodstream, and basically suffocating during the night.
So what happens when you stop breathing like that? How long does it last? How often does it happen?
Sure. It depends on the severity of the disease, but when the apnea occurs, the body senses that. The brain senses the drop in oxygen in the bloodstream, and it quickly goes into a panic mode. The brain can't wake itself up, so it signals the body to secrete stress hormones, adrenaline and cortisol, to stimulate the brain to come out of that deep sleep state and to take a breath. You take a breath, oxygen levels rise back up, everything's great, and then the muscles relax again, and the process just repeats itself. So it's a cycle of the airway closing, the body going into a panic mode, heart rate rising, and blood pressure rising.
So how bad is that for our health? I know that having these secretions of adrenaline, on a regular basis all night long your body was designed to, have that stress and have it short-lived. What happens when you have this stress happening all the time to your body?
It can be devastating. Particularly the biggest organ that's at risk with sleep apnea is the heart and the circulatory system in general. The adrenaline causes the blood pressure to spike up. It puts a tremendous strain on the heart, so we see hypertension or high blood pressure, atrial fibrillation, congestive heart failure. There's a greatly increased risk of stroke because as the blood pressure is rising during the night, that increased pressure in the body.
I've seen some amazing statistics that you're increasing your risk of heart attack like 5 to 8 times a normal person.
Yes, exactly. And sudden heart attack in the middle of the night, sudden heart attack or sudden stroke in the middle of the night is extremely dangerous. Diabetes, it makes it very difficult to manage blood glucose, so you can be at high risk for diabetes, weight gain, again for the same reason. It's very difficult to maintain a healthy weight.
So obviously when your oxygen in your body is dropping, it causes a myriad of health problems. So how does one diagnose this problem?
So it's diagnosed with a sleep test. Now, traditionally, you would go to a sleep lab. They would wire you from head to toe, and there's a technician that watches you sleep. And what I found is that has become kind of a barrier to people getting tested. They don't want to go to the sleep lab. And what we've seen is an increase in the popularity of home sleep testing.
Right.
I actually partner with a company that can send a home sleep testing kit to your house with instructions to use. It's real simple. It's just a little strap around your chest, a little thing under your nose, and a little pulse oximeter. And with those 3 points of data, you can determine if someone has sleep apnea and the severity of it. So.
I have to thank Dr. Harvey for diagnosing mine. I had no idea I had it. I thought I was sleeping like a rock, but when I did this home test, which is really very easy, found out that I had a substantial problem. So you can recommend that test for people. When should somebody think about getting it? I know if you're tired all the time or.
Right, tired all the time, someone with high blood pressure, heart problems. The other things we see is reflux, gastric reflux during the middle of the night. Those types of things would be red flag indicators of sleep apnea.
We have to go to break right now. We come back and find out how you can treat sleep apnea. Stay with us.
Is Mom really taking her medications?
A Comfort Keeper can ensure that your loved one gets their medications on time, providing peace of mind for families in need of flexible in-home care. Comfort Keepers, let our family take care of yours.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
I enjoy my active senior life, so feeling good and staying fit is important to me, but I wasn't comfortable joining a gym.
So my friends insisted that I would like physical fitness. A healthcare professional analyzed my body needs and developed a fitness program exclusively for me.
Join this week and your initial fee is waived. That's a savings of $99.
Love your life even more.
Call Physical Fitness today for your personalized medically based fitness program.
I'm Rob Wyatt, and I've been offering reverse mortgages in the state of Florida for over 21 years. If you are 62 or older, a reverse mortgage can allow you to access your home equity while staying in the comforts of your own home with no repayment obligations for the rest of your life. And you remain on title. Call us to learn how a reverse mortgage can provide you additional tax-free income to enjoy life now and create a peace of mind retirement for your future.
Comfort Keepers can provide a variety of in-home services for your aging loved ones. We'll assess their needs and create a custom care plan that can change as their needs change.
Comfort Keepers, keeping the comfort of home.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
Welcome back. I'm here with Dr. James Cannon, Sleep Institute of Sarasota. We're talking about sleep apnea and the devastating effect it can have on your health if it goes undiagnosed. Most doctors, sleep doctors, there are sleep doctors, treat sleep apnea with what's called a CPAP. It's a continuous airway. It's a machine that basically, it's like a filter that just pumps air into your lungs, keeps your mouth open. Right. Tell me about how you got interested in this or got exposed to sleep apnea.
Sure. I myself, like you, have sleep apnea. A few years ago, I was having real bad problems with just not sleeping well. I would sleep 8-9 hours, but I felt like I had slept maybe 30 minutes. I could barely get out of bed, just was exhausted in the morning. A lot of coffee, a lot of caffeine just to kind of get through the day. I had high blood pressure. I was about 25 pounds overweight. Was just not feeling myself. I had a conversation with my doctor, and she had me do a sleep test, which revealed that I was stopping breathing 14 times an hour, and my oxygen level was down.
Which actually isn't bad.
It's actually kind of the mild category, which is crazy that's considered mild. Yeah. But what really scared me is my oxygen level got down.
But if you think about it, it's like, what, every 5 minutes your body is waking up, so you're not really getting real rest.
Exactly.
And causing all these other health problems.
Exactly. So I had a dentist friend of mine. He made me a dental device, which I wear every night. And when I saw how much better I felt, when I saw how I could.
So you were talking to a dentist about it, who most people wouldn't think of.
Correct.
Treating a health issue like this.
Right.
And he told you about these dental devices.
Correct.
Okay.
And he made me one. And at the same time, I was also beginning to learn a lot more about sleep apnea, and I started treating it, but I saw it as something I could offer my patients and help them. But when I saw how much better I felt and saw the improvement it made in my life, I really became very passionate about it.
So this is kind of an area that I think most people aren't familiar with, even if they're familiar with sleep apnea, is that there are other ways to treat it other than through this machine that blows air into your lungs, which is certainly not the most comfortable thing to wear. And many, many people struggle with the compliance of wearing it regularly and all through the night and things like that. Right. I know I have struggled with it for a long time. Yeah. So tell us about these alternatives.
So CPAP, as you said, very effective, but the mask has to be strapped up very tight in order to create that air pressure in the nose or in the mouth. There's surgery. Tissues can be removed from the back of the throat, or even sections of the tongue taken out, and that's not done as much anymore because oftentimes those tissues grow back. It can be very painful. There are reasons to do it, particularly in young adults, maybe moving the jaw forward, things like that. But surgery really has kind of gone by the wayside. And then the dental device, and this is what I make. The dental device, because the tongue and the tissues in the back of the throat are attached to the lower jaw, or what we call the mandible. If we can move the mandible forward and hold it in a forward position, that brings the tongue forward, that brings the tissues forward, and essentially dilates the airway. They're adjustable. And there are some that you can buy, over the counter or online, but they're not adjustable. And the concern with that is if you're holding your jaw too far forward, it can really cause a lot of jaw problems, a lot of TMJ problems. So what we try to do is when we deliver the device is very slowly, 1/4 of a millimeter increments, move the jaw forward per night to find that sweet spot where the airway is dilated and open, but not so far forward that it's causing some jaw problems or jaw soreness. So.
Wow. So what does one of these things look like? They look pretty much just like a regular bite plate that would keep you from clenching and bruxing.
Exactly. And essentially it's kind of an upper and lower night guard, but they fit together. So essentially with sleep apnea, this is your upper jaw and your lower jaw. When everything relaxes, your jaw falls backwards and takes the tongue with it. So the dental device fits into place very simply, and essentially just prevents the lower jaw from falling back. And I know it's a little hard to see, but these are actually adjustable. And these tabs come forward, and so we're trying to bring the jaw forward.
I think that's important because there's a lot of these being sold online, and if they're not adjusted correctly, you can cause a lot of jaw and alignment problems, things like that.
Exactly.
So what kind of success rate are you having with this? It seems like a way simpler way to deal with sleep apnea. It's almost amazing to me that this would accomplish the same thing. But I guess it's really just opening that airway, and that moving the jaw forward accomplishes that.
Exactly. With CPAP, there have been good documentation to show that the success rate is 80-85%. The problem is compliance, and a lot of people that just won't wear their CPAP. Now they put a chip in it to really determine how much people are using it, and they're showing maybe less than 50% compliance with CPAP. The dental device the success rate is comparable to CPAP, but the success rate, the compliance rate is much higher. It's probably 90% of patients wear their dental device, so we can treat sleep apnea much more effectively with the better compliance.
So it's a pretty simple thing. I mean, just wear that, and I think, like you said, being able to adjust it is the key for you.
Exactly.
Are there any side effects of either of these types of treatments?
Well, with the dental device, because the device is attached to the teeth, it does put some pressure on the teeth, so you can get some minor tooth soreness. You can get some minor tooth movement, actually, and then also you can get some soreness in the jaw. But again, that's why we adjust very, very slowly to avoid, putting any stress on the jaw.
I've noticed with sleep apnea that people think that they clench all the time, and there was somebody that told me, well, people are having sleep apnea, which is causing your body to go into that fight or flight problem, and then they're clenching, because I've noticed I wake up and sometimes my teeth and jaw hurt from just clenching all night. But what comes first, the chicken or the egg?
Well, it's my maybe the first 10 years of my career, I treated TMJ problems and pretty effectively, but never really saw the connection between bruxism or clenching and sleep apnea. But there is a big connection between the two.
So what's the success rate of the dental devices?
For mild and moderate sleep apnea, it's about 85%. When we get to what we call severe sleep apnea, it does drop off. Now, people with severe sleep apnea, it can be used in conjunction with CPAP. So rather than strapping the mask to your face and turning the air pressure up as high as it can go, you can be fitted for the dental device. Now the airway is open, and now you can turn the air pressure down, which makes it a lot easier to wear. So it's kind of a combination therapy. So it's not it doesn't work for everyone, but it can also work for
Sounds like in conjunction, it could be like a really effective scenario.
Exactly. With the ultimate goal of just keeping people healthy. So,
going to go to break again. Check out our sponsors. We'll be back with Dr. Cannon. Find out how you can get the cure to sleep apnea.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
With the help of Comfort Keepers, I'm keeping my mom healthy.
I'm keeping Dad on schedule.
I'm keeping my mom happy.
Comfort Keepers in-home professional caregivers can provide meal planning and preparation, health and wellness services, and personal care services through custom care plans that can change as needs change, so your aging loved ones can stay happy and healthy in their own home.
Comfort Keepers, keeping the comfort of home.
I'm Rob Wyatt, and I've been offering reverse mortgages in the state of Florida for over 21 years. If you are 62 or older, a reverse mortgage can allow you to access your home equity while staying in the comforts of your own home with no repayment obligations for the rest of your life. And you remain on title. Call us to learn how a reverse mortgage can provide you additional tax-free income to enjoy life now and create a peace of mind retirement for your future.
I enjoy my active senior life, so feeling good and staying fit is important to me, but I wasn't comfortable joining a gym.
So my friends insisted that I would like physical fitness. A healthcare professional analyzed my body needs and developed a fitness program exclusively for me.
Join this week and your initial fee is waived. That's a savings of $99.
Love your life even more.
Call Physical Fitness today for your personalized medically based fitness program.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
Welcome back. I'm here with Dr. James Cannon. We are talking about sleep apnea, a huge problem, a huge undiagnosed problem. What percent of people would you say have sleep apnea diagnosed and undiagnosed?
Well, the most conservative estimates have been shown to be 1 in 8 people suffer from sleep apnea. I've even seen numbers down closer to 1 in 4.
It just seems like every time I'm in a group and people are talking about health and somehow gets on this, there's always somebody in that group that says, oh yeah, I have a CPAP or I have sleep apnea, or, I mean, it's unbelievable.
Yeah.
What are doctors, are being trained in this? I mean, is it being recognized as a huge problem that it is?
I think we're starting to see a big surge in recognition of sleep apnea as such a contributing factor to so many other medical problems that you're going to start really hearing about this a lot more. I know a few physician friends of mine, they said they really didn't get a lot of training at all, maybe an hour or two.
I mean, if somebody goes to their doctor and they have heart disease, I mean, it's probably the last thing you're going to think of, that sleep apnea could be a cause.
Right. Right. Well, too often I think that the medical condition is being treated, but maybe not looking for the underlying medical problem, which is essentially suffocating all night, which is causing that. So.
Yeah. So, when somebody comes to you, how do you diagnose this problem? I mean, do you order sleep test? How does that? What's the progression of?
Well, for most patients, I can order a sleep test. If someone has Medicare, then their physician would order that, the sleep test. They would have the sleep test, we'd get the results, and then we work very closely with that patient's primary care provider or the sleep physician. Their patient's physician has to actually order the device, but a dentist has to make it. So it really has created kind of a hybrid in between dentistry and medicine. So we work very closely with the primary care or the cardiologist to make sure we're providing optimal care.
So if somebody's in your chair, I mean, what kind of risk factors do you look for?
Well, and that's going back to sort of my story with sleep apnea. I never realized that it was looking at me right in the face when I would look in someone's mouth. And I mean, I've spent my whole career battling people's tongues while I'm trying to, prepare that last tooth here in the mouth, and I'm pulling their tongue back and everything. That tongue, that's the source of the problem. It's the tongue falling back into the airway. So since I've learned so much more about it, since I've been treating it effectively, when I look in people's mouth, I'm still looking for cavities, I'm still looking for gum disease, but I'm also seeing the signs of the risk factors for sleep apnea: the large tongue, the tonsils that almost touch together. It's amazing that air can even get through there sometimes for some people.
So, I mean, you've been doing dentistry for a long time, and now all of a sudden, you've been exposed to this. It's like the light went on, and you're probably seeing this left and right. So when you notice a risk factor for somebody and they have Medicare, you get in touch with their doctor?
Absolutely.
Okay.
Yeah,
and then he has to order the sleep test, or you can order it?
Correct. They would order the sleep test, and if they have private insurance, we'd still get in touch with them to let them know that we'd like to order a sleep test. I definitely want the physicians to be aware of exactly what's going on with their patients.
Right. And then does insurance cover?
There's coverage with medical insurance. A question I get from a lot of patients when they come in, especially into my office, is, I don't have dental insurance. And there's no dental insurance coverage for this at all. Because it's a medical condition, because it's a medical disease, it's covered by medical insurance. So.
And you mentioned that just by wearing this, pulling the jaw forward, you're able to help approximately 70+% of people that are dealing with this.
At least.
Yeah.
At least.
Are you finding people, what are some of the problems that people are coming back to you? How often do you have to be checked?
Well, what we do is when they wear the device, we want to ensure that they're feeling better, they're sleeping better. A lot of their symptoms that they can report to us are better. And then we want to do a follow-up sleep test with the device in place after we've found that right position where they're feeling better, but not where their jaw is hurting, to confirm that the number of times they stop breathing has gone down, hopefully to 0, but at least less than 5. That's the target goal. Problems, sometimes people have a hard time making the adjustments because they do the adjustments at home. So we're there to help them adjust the device properly. Some people just come in and have us adjust the device, and that's fine. But for most people, they can adjust the device themselves. And then we see people periodically, about every 2 to 3 weeks, while their jaw is moving forward, just to watch for problems.
Has there been kind of a sweet spot as far as how long it takes to get the adjustment right?
Usually about 3 or 4 weeks. When I first started wearing mine, I brought mine out way too fast because I thought I knew everything about it, and I did get some jaw soreness. So it really was a lesson in you've got to go slowly with it to avoid any jaw soreness. So
I mean, you compare that to people struggling with those CPAP machines for over a year. Right. I mean, this certainly seems like an avenue to approach.
Well, and the side effects of the slight jaw soreness, I mean, when you compare that to the average, the new drug that's on the market, and I mean, half the commercial is listed out all the different side effects that you can have, and it makes you wonder, why am I even going to take this medication if these are all the side effects? So again, just a little bit of jaw soreness or some slight tooth movement is pales in comparison to the benefits that we can get, the life-saving benefits we can get with this device.
What kind of stories are you hearing back from patients that are, successfully using it?
Just kind of a new lease on life, and that sounds cliche, but they wake up with energy to face the day. It can really help with weight loss. And I'm not saying that you wear a device and all of a sudden you're going to lose a bunch of weight, but the problem, if you're not sleeping properly, you don't have energy to go to the gym, your body's really not in a metabolic state to lose weight. So when you start breathing properly through the night, you start getting restful sleep through the night, you have energy to go on a walking program or eventually start going to the gym regularly. So it really can help just improve the way people feel and improve their
One of the things I heard, your brain and your body cleanses out toxins and so forth when you're getting the right kind of sleep.
Absolutely, because that sleep is necessary.
So where are your practices at?
So I practice, it's actually 3 locations, Sarasota, Venice, and Inglewood, Monday through Friday.
Awesome. Yeah. And so any special deal we can offer our viewers?
We are offering a complimentary consultation for the viewers of the show. So just mention that you saw us on Thriving on the Suncoast.
Highly recommend you getting checked out. If you're having any of these symptoms, ask your doctor about it. Very serious health issue and can be a whole new lease on life for you. I hope this was helpful. We look forward to seeing you again next week on Thriving on the Suncoast. Have a great day.
Comfort keepers, 'cause there's no place quite like home. Call Comfort Keepers.